Do you feel your child always has catarrh? It's as if it clears today and is back next week. The cycle continues. No mothers, you're not alone. There are actually medical reasons why this happens. And in this video, I'm going to be giving you in simple terms why this happens and what to do to prevent this from always reoccurring. Hello guys, welcome back to this channel. This is Dr. Lovable, and in this channel we talk about everything about your child's health, beginning from newborn up to adolescence. And then we also talk about our mom's health because we want our moms to be healthy. So if this is the kind of content you like, please hit the subscribe button. Now in this video, I'm going to be talking about reasons why your child always has catarrh. In this video, I'm going to talk about three things. The first thing I will talk about, why does it happen? Why does a child always have catarrh? Second thing I'm going to talk about is what should you do about it? Then the third thing I'm going to be talking about is when should you worry? So now, why does it seem like your child always has catarrh? The first reason why it's because their immunity is still very weak. Yes, so number one is their immunity. Children are still developing, especially children under 5 years. Their immunity is still being developed. So it's just like undergoing an exam. So you see, the more they're exposed to all these bacteria and viruses, the more their body learns to fight against them. So meaning that at that first stage, they will always fall ill, and you notice that with time, they will outgrow this and become stronger. So yes, because of their immunity is still very low, that is why children tend to fall sick very often. And the second reason for this is allergy. Children react very fast to allergies. Allergies like dust, allergies like some pets, allergies like powder, that's the talc powder. So if you notice that your child begins to have this catarrh or cough symptoms whenever they are exposed to a particular environment or whenever they're exposed to a particular substance, then you should know that that child is allergic to that. The next reason why your child will always fall sick is because they have narrow airways. They have small noses. So any little mucus buildup begins to cause them irritations and begin to make them fall sick. Another reason is frequent exposure. That's why you notice that these common illnesses, these recurrent illnesses are usually common in children who are going to school or daycare. Yes. So you notice that it's as if your child has been okay, but immediately your child started school, he has been falling sick often and often. So frequent exposure to school is one of the reasons why your child is always coming down with catarrh, because there is a mix-up from other children, everybody, they were crowded. So this can bring about the catarrh. So what should you do if your child always comes down with recurrent catarrh? The first thing you should do is help them make their nose to be moist and clean. I usually tell my parents, normal saline drop works magic. I use it for my child as well, and I am seeing it. Normal saline drop works magic. So all you have to do is apply the nasal drop into the nose. It helps to thin down the mucus, all those thick clump mucus, helps make it thin and easy to flow out. Then you can now use the aspirator bulb to aspirate some of the mucus from the nose in order to give your child relief. Another thing is very good hydration. Hydrate your child properly. Let them drink enough water, because the more they drink enough water, it keeps their body moist. It also helps to prevent buildup of mucus. Normal saline drop, which I mentioned earlier, is usually best at night because it helps the child to sleep. So if you know you don't want to be disturbed in the night from your child not sleeping well, making noisy breathing and low, then use normal saline drop. Another thing which is very important is no self-medication. Mother, I have always been talking about this. Avoid self-medication. Now, I want you to know that first of all is that most of the common causes of this catarrh and cough, that is common cold, they are viruses. Antibiotics does not kill viruses. Yes, so if you are giving antibiotics, you are wasting your time. So it's only when you go to the doctor and the doctor examines your baby, runs some tests, and then it decides to give you antibiotics, then you can take it. But if not, stop self-medicating. Viruses would continue until they run their course. Most times viruses just last for 2 weeks. So once they've completed their course, it goes and the catarrh clears up. But sometimes it's as if by the time it's clearing up, the child is exposed again and the symptoms start again. So that is where the recurrent illness comes from. It's as if as it's recovering, another thing comes up again. So it happens as long as the danger signs are not there. Then the last way you can help your child is by boosting their immunity. We have already talked about the fact that their immunity is low. So the best you can do for this child now is to boost their immunity. And how would you do that? By giving the child healthy food, fruits and vegetables which are rich in vitamins. So this can help boost their immunity. That's why you see most times when you go to the doctor after complaint and everything, they just end up giving you vitamin C. They are giving you that vitamin C in order to boost the immunity. So boost your child's immunity naturally, giving good food, vegetables. Also good sleep. It's very important for children to sleep because it helps the body to calm down. So sleep is very important as it is for an adult, it is for a child. We've talked about why it happens and what to do. But when should you worry as a mother? When is it something out of control? Whenever you notice that your child has fever, which has lasted for up to 3 days, then please you need to see a doctor for proper evaluation. Another thing is, when you notice that your child is suddenly becoming weak, suddenly sleeping too much, you know that it's not your child. As a mother, you have your instinct. You know that this is not how your child usually behaves. Please see a doctor. Then you notice that your child is having difficulty in breathing. I'll put the link for the video on how to identify signs of respiratory distress so that you can watch it and know when your child is having respiratory distress. Know when your child is not breathing properly. Another danger sign is when your child refuses to feed. You notice that your child is no longer eating well, then you need to see a doctor for proper evaluation. Another sign is you notice that the discharge is greenish and there is high fever. That might be a sign of pneumonia. You cannot treat it at home and it is not a virus, so it will not go on its own. You notice that your child has ear pain. It might be a sign of ear infection. Please see a doctor. So mothers, it is very normal for your child to always have recurrent catarrh, but know when to see a doctor, know when it's out of control. This is the Mom Health Desk. Please follow for more tips on how to take care of yourself and your child. See you in the next video. Bye.